Type 1 diabetes occurs when the body attacks certain cells in the pancreas. It's a disease that can cause major damage to the body's organs. Doug Johnson takes a closer look at what you can do to protect your child's health from the effects of this disorder.
There's a lot of work on a farm, especially when taking care of 13 horses is part of the job. That's something Lori Simpson handles in addition to her regular work in public relations. Late last year, she started experiencing a series of changes, including excessive thirst and sudden weight loss, things not connected to her hard work, but symptoms of type 1 diabetes.
We could tell that it was something that was probably going to happen because of all the symptoms I started displaying late 2009.
Type 1, also known as juvenile diabetes, is when the pancreas either no longer produces insulin or makes less than 5%. Insulin helps move glucose through the body, producing energy. Without it, glucose stays in the blood and can cause severe damage to the body's organs. And according to Sandra Hansel, diabetes educator at Baptist Memorial Hospital DeSoto, calling it juvenile diabetes isn't entirely accurate.
When we talk about juvenile diabetes, we're not talking about just kids, okay? Typically, that's what people think of, and the actual average onset for juvenile diabetes is about age 12.
Only about 10% of the 24 million diabetics in the U.S. have type 1 diabetes. Type 1 diabetics have to replace insulin in their bodies for the rest of their lives. Recently, there's been an increase in cases in children, mostly under the age of 5.
The onset of type 1 diabetes can gallop into your life anytime between the ages of birth and 30. It can be triggered by genetics, the environment, even an autoimmune disorder.
Simpson, an accomplished equestrian, takes a 24-hour insulin dose to regulate blood sugar levels during the day and a faster-acting insulin before meals to keep those levels in check as food enters her system.
Knowing what type of dosage I need to take on those right now is what's important, since I'm a recent diagnosed type 1 diabetic. Knowing, okay, I need to take 5 units versus, I don't need to take any at all, depending on the sugar and carbs in the meal.
One of the things that children and adults with diabetes that have to focus on are their consumption of carbohydrates.
Carbohydrates, sugars and starches in food, can have a major impact on how much glucose is produced. It's also important for a diabetic to stay active.
And then, of course, exercise is very important. I try to exercise 4 nights a week, and I have horses, so that really helps keep the blood sugar in check.
Occasionally, it's necessary for Simpson to actually take additional glucose to keep her body systems balanced. But it's important to know that diabetes does not have to limit anyone's level of physical activity.
Well, let me just say I've met several type 1 diabetics that are adults, and some of them have been seniors, and they have been some of the healthiest people I've ever met.
As part of a national effort to promote research and treatment of type 1 diabetes, the Juvenile Diabetes Research Foundation, the JDRF, holds its annual Walk for the Cure on Saturday, October 2nd at 10 a.m. at Shelby Farms. Go to jdrf.org for information. For Smart Medicine, I'm Doug Johnson.